Assalamu alaikum, Vanakkam and Thiruvan Saran. The world has encountered a global pandemic in 2020. This is known as COVID-19, the likes of which has brought dark days to our world, our nation, our economies, our businesses, and the way of life for each and every individual. While government hospitals are centered around the pandemic, private hospitals too are playing their part to battle this pandemic and to change its service delivery and operations models in order to continue its operations. Given this environment, here at Western Hospital, an ISO 9001 certified hospital, we continue to serve the public and the health sector in Sri Lanka with a safe environment, with the right safety apparatus, and we worked as diligently as possible, providing uninterrupted, high-quality healthcare services even during the COVID-19 healthcare crisis. This included uninterrupted services in relation to life-saving treatments such as dialysis, maternity services, OPD, IPD services, and even our pharmacy when hospitals and pharmacies around our immediate areas were shut and 13 people back, we continued to serve people. I think many people in our area really looked up to us as saviors when the doors were shut to them by others. We provided them essential services during the initial dark days of this pandemic. I think the main reason we were able to do this is due to our management and our caring and dedicated and multi-diverse staff, which include our doctors, nurses, administrative staff, cleaners, support staff, and other staff. I would like to call them COVID-19 saviors, not only because they put their life on the line, but also because they had to face severe psychological, logistical, financial, and even personal family issues in order to serve you all with a big smile. All this so that your health and happiness was maintained. Remember, we did all these services for people without discriminating on race, religion, color, or ethnicity. At Western, we can provide assurance that we ran our service delivery and operation management model based on the guidelines set by the Ministry of Health and the best practices that were set forth by the WHO, the CDC, the Sri Lanka Epidemiological Unit, the APHNH, and other institutions in order to prevent the virus entering our building while also maintaining a safe environment for our patients, consultants, staff, and wider community alike. The measures and protocols adopted include personal protection equipment for frontline staff, including specialized staff like doctors, nurses, frontline staff were all provided with the personal protective equipment. The PPE included masks, gloves, face shields, disposable aprons, goggles, etc. We also set up a triaging process that included placements of signboards for hand washing, isolation areas, social distancing, to name a few, were set up so that access and instructions were easily followed by patients and consultants and stakeholders alike who entered the hospital. Mandatory hand washing, face masks for patients, temperature checks were initiated in the hospital. Also, disinfection mats were set up so that transmission does not spread through shoes. Patient questionnaires were set up at various points to identify COVID-19 suspects. Non-touch hand washing and disposing systems were provided so that the virus spread didn't happen through hands. Separate well-ventilated spaces for seating of suspected COVID-19 and respiratory illness patients were set up with social distancing protocols in place. Also, isolation protocols were initiated, such as infection isolation rooms for COVID-19. For patients with respiratory infections as well, they were a separate room. Then we also provided isolation rooms for in-ward and dialysis services were also set up. In addition, patient transfer protocols, including notifying state authorities if patients were suspected of COVID-19 symptoms. They were transferred from here generally to the IDH. Also, a mandatory COVID-19 test for surgical procedures was made mandatory, including for the recently started kidney transplant program. We also undertook regular infection control and cleaning protocols, including providing special cleaning fluids, and machinery was set up for cleaning. Regular cleaning of high-touch areas in hospital, sometimes every 30 minutes, was undertaken. Ambulances and our other vehicles that provide mobile services were regularly cleaned if a visit was undertaken. COVID-19 isolation rooms and its related equipment were also built regularly. Batch rostering and work from home procedures were initiated, especially for people from high-risk areas. Visitor access and movement was restricted within the facility. Furthermore, regular monitoring and updating everyone on COVID-19 situation was initiated throughout the hospital. Furthermore, we provided training for all our staff and the community regularly through social media or our website known as the Knowledge Hub. Furthermore, given the nature of this pandemic, we had to resort to more services to the doorstep of patients, including delivery of life-saving medications. Mobile health and laboratory services were initiated during the period. Telemedicine services using our alliance partner services from Doc 990 and ODOC was developed and communicated. All these protocols and strategies has made Western Hospital a safe environment to undertake healthcare services during the pandemic. As a responsible hospital providing healthcare services, we believe we are playing our part to helping the government who are doing an outstanding job in the front lines of this pandemic. We will continue to support this government by providing uninterrupted services, especially for life-saving treatment, which will help ease the healthcare burden in Sri Lanka. My name is Omar Sharif and I am the CEO of Western Hospital. And I would like to say that our famous kidney transplant program has reopened to the public, and we will continue to provide uninterrupted healthcare services to the public so that we provide uninterrupted healthcare services even during the COVID-19 pandemic. Remember, your health is our mission. On a final note, I would like to say, obey the rules of the government, salute the healthcare workers, and take all the necessary precautions that are needed. Stay safe. It's very important during the COVID-19 pandemic. God bless you all. God bless Sri Lanka. And hopefully brighter days are not too far. Thank you very much.